Okay. Hello, everyone. So I'm Tawny Hemela with ICSI, and this is the second meeting around a collaborative collective effort across Minnesota and the upper Midwest to organize and mobilize support for our healthcare workers on the front lines of COVID-19. And we're talking specifically mental health support. I'm going to go ahead and pull up the agenda here. And as I do so, there are a few ICSI team members on the line with me. And I'd ask you to go ahead and unmute and introduce yourselves so that folks know who they'll be hearing from later in the discussion. Starting with Claire, if you'd be so kind.
Good afternoon, everyone, and thanks for joining the call again. I'm Claire Neely. I'm the President and CEO of ICSI. Welcome.
This is Sarah Horst. I am a team director at ICSI, and I am monitoring the chat room, the chat feature today. Thank you.
This is Jody Javorkin from ICSI. I'm the associate medical. Good to see everybody.
Thank you. And let's see, we also have on the line from the ICSI team, Lisa Carlson, Senka Hadzik, and Jean Monkman, all who are involved in working groups that you may have been on and who are supporting this work here today. So thank you, ICSI team, for being here. I'd love to do introductions of absolutely everybody on the line, and we won't be able to and still have time for what we need to cover. So a reminder that as you speak to something and share an idea or ask a question, please state your name and the organization that you're with so we all are familiar. Okay, I think I have successfully shared the agenda for the day. If not, somebody please help out and let me know.
We see it, Tawny.
Thank you, Sarah. Good. So as we get started here, a reminder of our antitrust policy that as we plan oftentimes as part of ICSI, this network, large scale macro systems changes, a reminder of antitrust policy that we don't infringe on things that would get in the way, talking about financial matters, et cetera. And so with that, we're going to jump right in. As mentioned, this is the second meeting around organizing mental health support for healthcare workers. And really, we had a phenomenal response last week. Lisa Burshak from CentraCare rose this in one of our working groups. Several other agencies jumped in and said, yes, we also think there's a need here that we can work on together. And within 3 days, we had over 80 up to 100 people gathered to begin to share practices and how to best respond to people's needs at this time. Last week, we defined our scope at the outset as that of, sorry, I'm going to stop, put my facilitator hat on. If you all can unmute your lines, that would be great. And I'm going to unmute some of you for you. There we go. I think we're better. Thank you. So as the group defined last week, our scope, at least at the outset, is really mobilizing support for those frontline healthcare workers. There are other areas that we could get into, such as support for people who find themselves on furlough or laid off, or other frontline responders in the time of COVID-19. Where we are beginning is with those healthcare workers responding to patients' COVID-19 crises. So I'm going to also call out, we've got a number of organizations and agencies across the state represented. Thank you all for being here. We have healthcare systems, both emergency departments, primary care administrators, mental health leaders from different settings across the state, mental health community organizations, county and state agencies, health plans, and associations, networks of critical access hospitals, and others. So we have that opportunity here to really come together and see, share those best practices and then see what else we can do in future. So today's agenda, we're going to continue doing more of sharing the practices as you all are setting up for responding to your staff's needs in this time around their own support for mental health and well-being. And think of it as a time to also be able to use this group to crowdsource. You know, what are the things that you're doing, certainly, that might be a good tip for someone else? But also, what else do you know is on your radar that you're going to have to plan for and you're not there yet? Use this group to crowdsource and ask those questions. Then we're going to share a new website ICSI has put together to be able to share the resources that you've shared amongst one another. And that'll be a preview, and we'll be speaking to that towards the end of the time at about 12:45. Okay. So let's get started in sharing practices. We heard last week all of the work that many of you are doing, and some of that mentioned were setting up to address people's basic needs, and by that also setting up those communication lines where how healthcare workers can also access mental health support. We heard about setting up a buddy system. We'd like to learn more about that. If there's anyone here on the call who has been setting that up, we would love to hear about that as well. And I'm going to just open it up broadly and ask for a volunteer to start us off by sharing something that you're doing that you feel might be useful to somebody else. And remember to unmute. Thank you.
This is Sheila Josie Gregoire from Mayo in Rochester. And I was asked by our ED staff to participate in a podcast. And that gave me an opportunity to talk about coping in the setting of a disaster. And they're interested in following up with a few more sessions. So I've been intrigued by the idea of a podcast as a way of providing real-time and modifiable content to first-line providers. I don't know if anyone else has tried that, but I'm interested to hear from the rest of you.
Thank you for starting this off, Sheila.
This is John Magnuson with March.
Welcome, John.
Are you able to hear me?
Yes.
Very good. What we have instituted is a monthly all-member call, weekly all-member call to keep people abreast of what's going on, and then segmented our professionals into learning communities with their own specific weekly Zoom calls. We have our frontline professionals, our billing specialists, and then our HR specialists, and I guess we have a fourth one as well, our executive leadership. That way we can respond to the specific needs of our professionals while also giving them the training and guidance that they need to do their function. But we have the full membership come together once a week. And thank you for the opportunity.
Thank you, John, for being here. Other examples. I know some things were shared last week in the chat by both Alina and Health Partners. I don't know if you happen to be here, but if you are, we would love to hear what you're doing, or another group as well.
Good afternoon. This is Carrie Winning from the Minnesota Medical Association, and the MMA and PSP physicians serving physicians are putting together a virtual support group via Zoom, which will be starting next week. And all physicians are welcome. It will be in the PSP model, so there will be confidentiality for physicians and anonymity for those who choose anonymity. And there will be moderators or facilitators in each of the breakout rooms to make sure that the support conversation steers in a positive and inspiring direction.
Great. Thank you for sharing that, Carrie. Really cool to hear about that response to the need. Is this something that we can help spread the word on?
Absolutely. Like I said, our first support group meeting will be next week, and we'll be finalizing the details for that today or tomorrow. And so once we have those details finalized, we can certainly, I can share those with the group. At this point, we plan to have one support group meeting a week, but we discussed the potential to open that up to additional times and days a week if the demand is there, and to ensure that it works for everybody's schedule who feels like that support would be valuable for them.
Mm-hmm.
This is Sheila. Is that available to non-MMA members?
That is still something in the works. I think that I know that that's something that we are definitely open to. So if anybody has feedback about that, and I would be glad to hear that feedback.
This is
We made
Sheila
all of
again.
our,
Sorry, I think it would be helpful to open it up to others. I'm sorry for interrupting.
I was just going to add that Mark made that decision. We debated that and made our all member meeting open to anyone who had an interest in the substance use disorder continuum.
Great to hear. Good. I think in this time of COVID crisis response, many of us are doing similarly, and appreciate MMA thinking that through, and all of us as well. So we heard about a podcast idea. We heard about opening up Zoom meetings for March members, substance use treatment providers and others, and MMA support group for physicians. What are things that others of you are doing?
This is John Alvin from Sanford Health, and we've had for about the last, I think it's 8 or 9 years now, we've had an internal EAP type service for our clinicians who are showing signs of distress and burnout. And so it's a nice service. We follow pretty much an EAP format, so it's 1 to 3 sessions, but it takes place outside the medical record. And this has just been a nice time to reach out to various departments. I've been invited to a lot of department meetings to just to do like a 5 minutes or less. Here's some ways to be thinking about enhancing your coping, and then also to reintroduce the internal EAP service.
Nice use of and repurposing of an existing structure similar to MMA using their PSP model.
Tani, watching the chat, Sue Abderholden chats in, we're happy to host a support group for other healthcare workers. We have a series of podcasts, especially for people from communities of color.
Oh, excellent. Sue, thank you, and feel free to jump in by voice anytime if you're able. So many of you last week were talking about how to identify your specific internal populations who need support and what kind of support. I know Lisa Burshak from Centricare, you were speaking to identifying those populations and having a framework by which to do so. So any of those efforts as far as coordinating with your incident command team or whomever is responding, anything else to share there?
This is Lisa from Centricare. In the last week, we've become a little more formalized. Our team is now aligned under our planning committee as a part of Incident Command. And as the leader of our staff support response team, I'll be communicating directly daily with that planning committee. And I think that's going to massively help our ability to communicate needs, learn quite quickly what needs they're hearing from across our system. So I'm really pleased about that. We're also using our EAP to be our response for individual needs, and we've created a plan on how to advertise that more fully and have a flyer specifically for what kind of COVID concerns people may be having anxiety or stress about, so they understand they can use EAP for that. And we're also having them likely, we're not finally approved yet, but likely reaching out to our furloughed staff, and then would be looking at the furloughed staff on a weekly basis if we can get that approved. So people are getting quick calls and connections for support as they're furloughed. And then we have a subgroup that's really looking at how to support leaders, both with their own stress as well as managing things and putting together some toolkits to manage the stress of their employees. And we have a group that's looking at frontline COVID. And so we're going to work this weekend developing a model for early intervention and outreach to the high-risk teams. And we'll handle that internally with chaplain and behavioral health support. And so setting up, emails, daily huddle, things that can be used for resilience building and coping, potentially looking at embedding to build relationships with the team before the surge hits, and then kind of a crisis response for those indicated teams that are dealing with kind of the high-risk medical decision-making and situations that arise that we can very quickly do some, mental health support as individuals are needing that in those teams.
So Lisa, this is Claire Neely at ICSI, and I'm wondering if you can tell me who you've identified as the high-risk teams. I mean, some may be obvious, there may be some thinking about that would be helpful for us all to know.
Sure. I actually just ended that call, and so it's still a little bit in flux as we look at going back to incident command now and determining if we've hit everyone, but really looking at the respirator/ventilator teams that will be working on those cases directly. And within that, we kind of have the care team, we have the triage team that will make some of those hard decisions, and then those teams that are providing that comfort care is maybe somebody's removed from a ventilator. We are looking at our ER teams, our EMS teams. One thing that CentraCare is doing is building an acute respiratory clinic, so kind of as a first line response on an outpatient basis for individuals presenting with higher level symptoms to determine to triage back home or to triage into a hospital setting. Our critical care units, including pediatrics. And so that's kind of where we're starting with what we're determining our high risk, but I would love to hear from others because I'm sure we've not thought through everyone that we should be including. And so I'd love to hear from other folks on maybe what teams they're determining would be critical response needs.
This is Sheila. What about occupational medicine or your folks who support the health broadly of your group?
Thank you, Lisa.
This is Jeff Leichter from Sanford, just following up to Lisa's comment. I think I may have mentioned last week in our weekly meeting that one of the things Sanford is doing is we've put together a 15-minute wellness presentation, and we're going to be rolling it out to some selected service lines facilitated by behavioral health or spiritual care or organizational leadership execs in our organization. But we had a conversation about who should we try to roll this out to first, and where were the priorities. And the initial thought was, primary care and ED and things like that. But we actually made a little bit of a pivot, and we're actually going to try rolling it out first to lab, patient access, and IT. IT is under incredible stress because we're trying to shift our whole organization from face-to-face visits to video visits, and so our IT staff are getting hammered. And there's a lot of fear among our lab staff about just handling blood and being asked to turn around COVID tests as rapidly as possible. So actually, I was one of the people arguing for primary care being rolled out first, but once we talked about it, We decided that we weren't going to bug them just yet with one more thing to support them, but we try to get some of the folks maybe who don't always get quite the amount of attention as primary care does. So lab, IT, and patient access will be our first target audiences.
Thank you, Jeff. Other thoughts on populations that you're focusing on, to Lisa's question?
Well, I hope I understood Lisa's comments or questions properly. These are the employees in those particular service lines that we're going to try to target for some mental health interventions and piggyback onto their existing huddles or staff meetings or what have you, and to be able to deliver some very concise behavioral health coping strategies and facilitate some dialogue around what are they afraid of and get them to talking with one another, and then try to give them some pointers about how to support one another during the day. So I hope that's where the conversation was, and maybe I misunderstood.
Oh, that was perfect. Thank you, Jeff.
Yeah, so I'm Ashley with Sanford out of the Northwest region, the Bemidji area. And so I echo kind of what Sanford across the enterprise is doing. I know we're also trying to train our managers and leaders in psychological first aid. I'm not sure if that's been mentioned already, and I got the email earlier in the week from you, Tani, and that was really awesome. We're also trying to create a self-care space within our medical clinic setting. So people, when they have their breaks, when they have their lunches, when they're trying to decompress from going from the floor to home, they have a spot where they can literally go and potentially, it might be, we talked about locating it in a gym where they can literally go work out if that's what they need, or we'll have some separate spaces set up that could be like meditation or calming rooms. We're hoping to be able to pilot. We're taking the 6 dimensions to wellness approach. So we're addressing physical, mental health, spiritual, financial, educational, and social well-being. And we'll hopefully have an online tool that could be accessible for any employees within our region that they can click on I'll just use mental health, click on that mental health piece of the wellness. And we have local leaders and managers and supervisors within the programs that do short 1-2 minute clips to guide people through different coping skills, or our fitness team is going to put together some short clips on here's a 3-minute chair yoga piece that you can use as you transition from the office home type of a thing, so that they're not having to read. Lots of times when we get in that prolonged stress brain, we lose the ability to maintain focus and read something and comprehend it. So make sure that we're trying to engage all the different senses at that point that can help transition people to a more focused kind of brain and mindset type thing. So those are some of the different things that we're looking at, and hoping that the psychological first aid, that those managers and supervisors across the board can identify who on their teams would need the most maybe extra support at this time. And they know what to look for and how to have those conversations with people across the entire space and time. I know right now we only have a couple of cases in our area. So the staff that we're actually talking a lot about are those furloughed staff, because they are potentially have a loss of income and also want to be part of when there's a pandemic or trauma or stressor. Part of coping is that we're part of the solution. And so what it might be like to have to sit and wait and not be included in part of the solution.
Right. Thank you, Ashley. So we've heard a few different types of things that different healthcare systems are doing or different organizations are doing for their networks. One of the things that was touched on from John at Sanford was about using their EAP process and group. I'm wondering if anyone else on the call is maybe from an EAP department. I know some were thinking of coming if they could. So anyone else on the topic of EAP? It's always something to like gauge how long to wait for people just to be ready.
This is Sue
Thank
after
you.
Holden. One thing I just want to mention with EAPs that we know is true just regularly is that few employees actually use them. And so I think there almost has to be also a kind of a special effort to make sure that people know those resources are there, because they usually kind of forget about them. You know, how many talks with the therapist can you get and those kinds of things. So because I've been working with, you know, some of the health plans and self-insured companies who've looked at this, and the rate of use is pretty low. So I would just encourage people to really make sure your employees really know what's there and how to use it.
Thank you, Sue. So any other practice that you're doing, that you're setting up, that you want to share that you haven't yet heard about here today? Because while what you're doing might seem to you that, well, this is just basic, nothing special, what we heard back from several people after last call was that was invaluable to hear. We, you know, on these different pieces, different people are at different processes, and certainly as we discussed last week, preparing for this type of crisis and for this length of crisis is unique. So
I'll jump in there again. It's John Alvin again from Sanford. I think that just one thing that it's maybe subtle but important culture-wise is some guidance that we can have about how to train people who are leading meetings to engage people more, in terms of emotion-focused coping versus problem solving. And also asking questions that elicit wisdom rather than elicit knowledge. Trying to get people to start out. I think it was Krista Tippett. I think she had a line that said, you know, what is bringing you despair, and what is giving you hope. And so, and even just starting out a meeting that way to try to get people to talk more about how they're coping. This is an opportunity for us to try to actually maybe pull ourselves a little bit closer together, even though we can't do that physically, but to do that emotionally with each other. Also, the other guidance that they had for structure was thinking about a call to action for that particular meeting. So labeling, you know, what's the biggest challenge that we have right now, and then and what are we going to do about it, so that there's a strong focal point to the meeting as well, and then of course having time for question and answer. But I think that's just knowing I'm part of a lot of different meetings within our organization, and just those few things that I mentioned would transform many of the meetings that I'm usually a part of. So it's an opportunity.
that's excellent. That's wonderful to hear about. And it gets back to something that Ashley was saying as well, where when people's brains are consumed with that moment of, you know, crisis or fear or whatever, you can't engage on that cognitive level anyway. So we are together in that chance to get together in a different way. So love to follow up more on that with you, John, offline, which I will do so. And so to that point, you know, John asked a good question as he's thinking about helping their leaders and staff run their meetings in a different way to be more meaningful and meet people's needs. What all is bringing you heartache and tension that here with this group, all looking to also provide support for their workers at this time? What's something that you're looking to be able to get more support for?
This is Sheila. I think it would be helpful if ICSI could come out strongly with a set of best practices. I think we all, maybe I'm speaking broadly here, but I think we're all struggling for what is what is the best use of our time? What's the best use of our colleagues' time? And, I was thinking about bringing this information back to my own department. And, if at the end of this session, or maybe a couple of more sessions into this, ICSI could publish, these are the best practices that are coming out of these collaborative efforts of meeting with large groups. I think that would help us go back to our own institutions and say, let's put some effort into this, whether it's, broadly committing to psychological first aid for, all supervisors, or whether it's to have an embedded mental health provider in high-risk groups or other. I think that would be helpful to me, because otherwise it's just, we don't really have a well-established game plan for how to help our own staff. This is so unique to have our own professional staff really being victims as well as providers at the same time.
Thank you, Sheila.
So Sheila, this is Jody from ICSI. That's a fantastic point. That's really exciting. I would ask the group then to follow that trail. How are you getting feedback to whether what you're instituting, a program, meetings, trainings, is actually kind of helping, right? So what's the feedback mechanism that we can say this would be a best practice because they found it was successful because? And I think in this challenging time that might be hard, but wanting to know how people are doing it right now.
Connie, checking in from the chat. We've got some conversations about information on moral injury. If people have to make decisions in the future about who lives and dies based on equipment, moral injury is going to be a long-term battle. So,
great, thank you. And so I'm going to put a pin in Jody's question, and Sheila, your idea about ICSI helping to share and publish ideas on best practices, I think it's a great point, and we'll revisit that at the end of the meeting. Thinking of what people want support for right now as they're setting up, I'm going to ask whoever chatted in around moral injury, if you would go ahead and speak to that a little bit, we'd really appreciate it.
So is Ashley able to speak to that? Ashley McMartin?
Yeah, so I was kind of piggybacking off of either Casey or Cassie, I'm not sure, his or her comment on the moral injury idea. So in mental health, we see this a lot in regards to kind of PTSD and those that have potentially been in war or maybe have done some work in a place that's experienced a catastrophe. But just at the end of the day, when someone has to make a decision that goes against their kind of moral compass or the lesser of two evils, how as a larger system can we help support them in that process and potentially help them process through it, because it'll possibly be something that will influence their decision-making ability in the future.
Thank you, Ashley.
I think a common one that we're seeing in our culture is around, and nationally too, is around it, their available PPE. And so this idea that that I'm going into the front lines for my work, and there's a perception of I don't have adequate PPE, or that we have to conserve PPE, and then that that can be really challenging. So the providers feeling like they themselves are not adequately protected, the possible exposure to others they care about, and but at the same time are stuck with, I still need to do my job. So there's, I think, a pretty consistent example that we're seeing around here.
And this is Claire again, and from talking to some folks in Seattle, they're dealing even with the more complicated ones of who gets a ventilator and who doesn't, or when should someone be removed from ventilators. And those are going to be really long-lasting effects on the folks that have to make those decisions. So thinking about how to work ahead of that, if there is a way, could be very useful.
Checking in from the chat, adding to John's mentioning the families. Oh, it's moving fast now. Gretchen Carson says, is anyone doing outreach to the families of healthcare workers at higher risk for infection for the stress those families are also experiencing? And Lisa from Center Care, I don't know if you want to talk about the letters you're sending.
And in case Lisa's moved away, I would mention too, Lizzie Jansen, I see you have a question about EAP. Would you go ahead and share that with the group?
Yeah, for sure. This is Lizzie Jensen from Planned Parenthood. I'm just curious, you know, we have obviously been providing our EAP support to everybody, and after checking back in with our EAP provider, who's not embedded, they're an outside group, we have had no change in our use to EAP since pre-COVID, I guess. And so we've really been brainstorming. I mean, we're trying to open up to utilize more of our internal social work resources as well for staff. But if anybody else has had other really creative ideas of, you know, we know that healthcare workers are the least likely sometimes to be reaching out for help. And oftentimes people kind of get stuck in the mentality of, you know, if they don't have it the worst, that they don't have any ability to complain or don't have a need to reach out. But wondering if other people have found creative ways to really encourage utilization of the EAP or other ways to get staff who are experiencing distress really engaged.
This is Sue. I mean, we have, obviously it's a very small organization, but we actually have a wellness board in our kitchen, you know, where people get coffee and where the refrigerator is. And so they, the wellness team puts up kind of new information once a week, including different things that are available through our EAP, so that it's kind of constantly in front of someone and not just a one-time shot.
This is Lisa Burshot from Center Care. To kind of hit on both. So somebody had asked about whether or not the fears for families connected to individuals at high risk of exposure in our hospital system. We determined as our staff response group that the most universal way to hit everybody and to really engage with the fears that we have as a healthcare agency is for executives to send an all-employee letter. So hopefully by the end of this week, we'll have a letter going out to each and every employee that works for Center Care. And it's going to kind of address that human vulnerability and fear for ourselves as healthcare staff, as well as for our families, and just acknowledging that fear. And then we'll be building, hopefully, an internal site for resources available to employees. We'll direct people there, as well as also kind of lay out very succinctly with not too many resources, Air Care, which is our EAP. And again, we built a special EAP flyer through our employee health that very specifically touches on the fears and concerns and anxieties that you can have around COVID and how you can get personalized as well as family support. So again, we're directing our families and our employees back through them. And we have seen an uptick in our EAP from what we're hearing from employee health. And our team spent about 30 minutes on the phone on Monday with our Air Care clinical director. So really being able to spend some time with that EAP person to really determine what they can do for us, what they can't. And, you know, again, they even talked about having the bandwidth, you know, if there's some staff who just need to talk for 10 minutes before they go into a shift because they have really high anxiety, they'll take those calls right now. So they're going to shift how they support. So I think that I would just highly recommend, again, collaboration is so key. So how can you collaborate with your EAP? How can you maybe develop materials specific for addressing COVID? And I think, you know, that's going to go out in our employee letter, as well as how people can contact our staff support team, our chaplaincy, just to make sure that people have those fears and needs addressed. So that's a little bit of what Center Care is doing.
Thank you for the question, Lizzie, and others, and thank you for the responses, all of you. So we're going to go ahead and shift to the next item pretty soon, which is sharing with you the resources that you've shared in the website where we've put them. Before we do so, any other questions that you have for the group? You know, and I will also ask, there's a few types of organizations we haven't heard from yet, or organizations in general that we haven't heard from yet. So thinking of others in doing community mental health or community health centers, or other associations or organizations. I know I see some of you on here. Anything that you would like to add before we move on? Okay, just want to make sure we're creating the space here. So I'm going to stop sharing this. Let's see if I'm successful. I think I've stopped sharing that. And I'm going to pull up this new web page. So you all have shared a whole lot of resources. We've been going through and curating them. Particularly Jody Dvorkin, our Associate Medical Director, has been helping to organize this alongside with Bonnie Harris, our fabulous communications guru. And so I think I've shared the website here.
We see it.
Wonderful. ICSI team, you've not even all seen this yet. So here's our preview. This is a work in progress. And so Jody, I don't know if you have the main page that we're showing today, if you have that up or you're able to see. I know you were maybe going to be on your phone. Okay, good.
Yep. So I'm on the phone, but I'll have you scroll. So thanks, everybody. Just quick summary. So from what we heard, we decided to divide it into kind of two main buckets. And system support for healthcare workers, and that's a lot of the stories, a lot of the programs you're implementing, what you, the system, can really help do. And then self-directed support, right? So whether those tip sheets, podcasts, apps that people can use, but they can go themselves and get it, and you just kind of direct them to it. The former, which I think is what more this group has been talking about in terms of system support. So within that, we've just kind of divided into some categories and would love feedback. This is an iteration, and we're happy to keep iterating. Talking about some resources on planning and developing infrastructure. So as Lisa talked about, kind of incident command, how do you develop and set that up? We have some resources. To be quite honest, here's where your kind of stories and what you're doing is going to be more helpful, right? So I can refer you to a lot of websites. A lot of them say all the same thing in general terms, but what are you actually doing? A lot of the conversation you guys are having now, that being on a site that people can go to if they miss this call and have a contact, a brief summary, and somebody to talk to and reach out to, that would be really helpful. So there was that infrastructure development. There was the training, a lot of talk about psychological first aid, and that's great. You know, the other part that we wanted to add to the training, and John, you spoke about this, is how can we train our leaders, those attending physicians, those nurse managers, to hold a meeting, administrative staff, and hold a meeting that's effective, and that, you know, that they can understand what their role is as a leader, and also how to support them as leaders, because that's a whole nother stress to be a leader of a team while you yourself are, you know, having difficulties. So we'd love to add some of what you all are doing about leadership training in this. Counseling, and so these are things that we would hope to flesh out. Offering counseling, you know, there's all these warm lines. I think Hennepin has their own support line, and that's fantastic. And then there's the community support lines. But also in counseling, you all talked about last time about having counselors in the ED or in the ICUs and just being there. And I think if anybody's doing that, those are helpful stories. Those are kind of what you all are doing. That would be really helpful. I think, Lizzie, that gets a lot to what your point is that people won't reach out for help. So how can you put help in place so that they kind of get it, you know, automatically, so to speak. So we'd love to add those stories. Assisting with basic needs. So this is in development. I think, Lisa, you talked about respite rooms last time, setting up respite rooms. Are there things you can do for food, you know, that would help? I know coffee stations and things have been taken away, but Can systems provide food in a different way that would be helpful? Can there be something about sleep, doing rotating schedules to be mindful? So what can systems do to help these workers? What are policies that can be put in place to kind of assist with these basic needs? And I'm sure some of you are already doing these things. And then support groups. Last time I know Eli from U of M talked about a buddy system. We'd love to hear more about that. There was a talk about a town hall. I'm sorry, I can't remember who talked about that last week, but a town hall to kind of have support with one another. So these are things that you all are doing that we want to add to this site. Those are the categories we have now. We're trying to keep it really practical. And so I think what we envision, well, let me just get to the tips. And then, so what workers can do for themselves. And this part's more of the direct them to this, but nothing more you need to do. This is not policy. These are resources. So there are tip sheets. We're trying to kind of look at all the things you sent. There's a lot of redundancy. So picking the ones that maybe capture everything, but not putting every site. I think it's easy for people to get overwhelmed by resources and add in social media and a ton of resources floating out there. And we don't want to overwhelm people. So we just tried to pick out the things that maybe were the most inclusive of the resources you sent. So tips, free apps, and then podcasts. I'll just end by saying we would love to kind of fill this out with more of what you're doing, those practical things. We'll send as a follow-up some maybe kind of ideas of what you can include as a quick synopsis of what the work is, kind of what it takes to maybe get it started, you know, what the resources are needed. And then if you want to share protocols, great. We understand, you know, that might not be allowed or you have to check with somebody and that's okay. But if you can provide a contact person that people then can at least contact you and get more information, that would be a great start. Okay, I'm talking too fast. Tani, what did I miss?
That's great. No, I don't think you missed a thing. Thank you for the comments in the chat about appreciating the work that Bonnie and her team and ICSI Jody has done here. Really, it's all because of you. You all came together and you said, we need this here, share this, share this, share this. And so we have this great opportunity in the Minnesota and Upper Midwest to where you get it, you get together and you want to share and make it happen. So for this site, I think Jody's kind of our key questions are, is this organized in a way that makes sense for people to easily find what they're looking for in general? If there's any big way that doesn't happen, could you please let us know? So that's one question, whether it's working or not, and we'll send the link after this meeting or later today so that you will be able to receive it and let us know. And the second is, you know, and this gets to Sheila's good point earlier about managing kind of a compilation of here's the best things to do when you're preparing for this kind of response. And so it's kind of a, you know, getting two birds with one stone. As Jody was saying, to be able to have examples of how you're setting up to get better uptake on your EAP, how you're setting up to be able to, you know, bring food into your workers and at the same time then providing those connections to mental health support, or identifying your populations. You know what, we found that we needed to get support to IT, we needed to get to support to front desk staff first, or those furloughed employees. Those practical things that are really helpful. If we can gather those in just quick bits, we'll help compile that together and put those on the website here. And you share as much as you're comfortable and able to share publicly, of course. But then secondly, then that also helps us be able to organize and get those best practices together, kind of as a sort of guidance as Sheila was mentioning as well. So any other questions from the group or comments on this? Any categories that you would see missing? We based these categories off of our conversation last week and from what we were seeing so far in the resources. Would there be a missing category or something that you would add?
Tani, this is Sarah. I would add, a number of you have said that you have support groups or webinars that people can log into. We'd be certainly happy to put those here if you'd send those to us afterwards. We'll capture what we can in the chat, but if it's not there, please do email us and we can include that.
Thank you, Sarah. Okay. So with that, we're going to go ahead and begin wrapping up and preparing for our next meeting. So based on conversation last week, we set up just a few weekly meetings for this group to be able to troubleshoot and support one another in this time. And for our next agenda, in addition to thinking about what are those practical examples that you can share, we'll reach out to you with kind of a template of what we're looking for. In addition to that, then next week, what we would like the bulk of our conversation to be around is what type of effort, what can we do collectively that will support the broader network. This is that initial part, and we do this in our other working group meetings, right? There's an identified problem, there's an identified need, and let's go to the community. What are you doing that works? What are you doing that works? And share and build that support. The next step is identifying collectively what else needs to happen to be able to either identify good practices in this time or accelerate their adoption. And how can we do that as a community and rapidly? We've got healthcare systems, health plans, state agencies, associations, community organizations, et cetera. And this is a time to spread those good learnings and support as broadly as we can. So be thinking about those collective opportunities. Sheila mentioned one today, Sheila from Mayo, around compiling that guidance together and publishing it in some way. Another that came up last time was holding an echo specific to troubleshooting various things or mental health support, maybe specific to different settings or different needs. And now we've got more support groups coming up, both from MMA, from NAMI. You heard from Sue, a willingness and desire to help and perhaps provide some support groups for others. And there's more to come. So with that, that's all for today. Thank you all for the work you're doing. Great to see your faces and hear your voices, and stay healthy.
Thank you.
Thank you.